Hey mamas, welcome to Breastfeeding Relief with Bethany. We share incredible stories, tips, and breastfeeding ideas to help on your journey. I'm your host, Bethany Laverne, a lactation consultant and speech therapist who helps mamas with breastfeeding. Not all breastfeeding stories are the same, and we dive into those topics. Welcome back, mamas. I'm so excited to have you today. So today, one of my biggest things I love to talk about is doing a tongue tie and a lip tie release with a team. Okay. This is the biggest mistake I would say that I made. And I would say no fault of my own because no one told me, right? It's that whole phrase. I don't know what I didn't know. I had no idea that I should be working with anybody else besides pediatric dentist. Yes, I went and saw my lactation consultant, and she was the one that said, you need to go see a pediatric dentist. I can't diagnose, but I'm saying, please go see one and get in on his books as soon as possible. And he was able to see me tomorrow, which was fantastic. However, that pediatric dentist never called me once, never followed up. I never went back to his office. And the other thing is I had to pay cash. My insurance did not pay for it. So I believe for the initial 15-minute conversation, which was less than that, was $75. And then I could pay cash after that for the procedure, which we decided to do that day. However, I do not recommend what I did, and I have seen huge consequences in my son because of it. So let's talk about what a good release looks like. So let's start out with, first you need to go see a lactation consultant, a speech therapist, or an occupational therapist. Okay, you do not have to see all of them, but people like me, I am a lactation consultant and a speech therapist. A lot of occupational therapists are also lactation consultants. My friend, she is personally a NICU occupational therapist that is also a lactation consultant. She is fantastic. You can go follow her on Instagram at thenicu.ot. She's fantastic. Highly recommend her. She also had issues in the NICU and then decided to become a lactation consultant. So you need to go see someone that has these credentials behind their name, and they will give you a functional feeding assessment. So what we're doing is we want to see you breastfeed your baby. We want to see you bottle feed your baby, whatever feeding looks like for your family. We want to look at latch positioning. We then get into their mouth and want to look at how their tongue is functioning, right? A baby's not going to follow commands and say, lift your tongue up, right? We actually have to get in there with gloved fingers and lift it for them to look at how their tongue is moving. This is especially important. I always say, make sure they're getting your baby out of their car seat, right? We usually walk in with babies in their car seats. It is very easy for us. And nowadays, some of these car seats come with strollers attached. I saw someone just pull it out of their car and pop it up the other day. They're amazing, right? They make it easy for us moms. I love that. However, they should never be doing an assessment in a car seat. Okay, make sure they're getting them out. If they do not get the baby out, you need a second opinion. Okay. Next person who should be on your team. Now, the speech therapist, occupational therapist, lactation should refer you to somebody in your community that is an airway focused dentist, a dentist, a pediatric dentist that is releasing tongue ties with a CO2 laser. Or if you do not have one in your area, or you have to drive hours to get to one, that is the case sometimes, go see a ENT. They also help with releasing tongue ties. They can do it. One of my friends, she had her baby's tongue tie released in an ENT's office while dad was holding the baby. So they swaddled the baby up. Dad was holding the baby, and then they released her tongue tie in the office. That was fantastic. Our son's was released at a pediatric dentist's office. It was not done correctly. We had to get it done again when he was 3 years old. I could not find one in the area that would deal with a squirmy 3-year-old, is what I was told. However, Dr. Richard Baxter, he will release, he says, anybody, any age. He says he can get them to sit still and to do a deep enough tongue-tied release. However, I could not find someone close to me, so we did go to an ENT, and the ENT then released it for us. And so you are looking for someone that I want to say is a tongue, lip and tie provider, that is what they specialize in, right? And so I've heard from other dentists that they start on adults, get comfortable with adults, then do teenagers, kids, right? So they can say like, yes, you released it enough. Yes, we look at function of the tongue. Can you lift it side to side? Does it feel deep enough, right? After they get comfortable with that, then we do babies. Babies should be last, and they should be very, very comfortable with releasing a baby. They do help with swaddling the baby. There's always an assistant there to help hold the baby so they don't move. It's also done a lot easier and a lot better when they are younger. Lastly, I want to talk about all the tension that your baby will have in their body. My son had so much tension. He was hard to pick up. He was hard to hold. He was hard to change because he was so tight. I had no idea. I just thought he was being a difficult baby that didn't like to be changed. So I suggest you go see a physical therapist or a craniosacral therapist or a chiropractor. And some of these people have, just like me, have multiple credentials. I know a lot of PTs that also do craniosacral releases. I also know a lot of chiropractors that do craniosacral therapy. So currently where I live, I refer to Dr. Molly. She's a chiropractor that also has craniosacral. We have started working together. She's fantastic. She's helping, work on getting them not as tight. These are really helping moms specifically on their breastfeeding journey when the baby has torticollis. So torticollis is a fancy word for tightness in the neck. And so these are your babies that their neck is always scrunched to one side. They're super tight and they only want to eat on one side. So they're only wanting to eat on your left breast or your right breast, and then you're having to pump the other breast, which as busy moms, active moms, that is difficult to do. And then they might not be getting enough food. And so then you're also having to give them a bottle because they won't go to the other side. So that is what a team approach looks like, mamas, and you should be working with them. The idea, let's talk about what it ideally, so it goes smoothly, so we aren't having to do the release again, and you are seeing good benefits afterwards. So the best thing I suggest to do is to see someone in body work, that chiropractor, for 3 weeks before a release, and also seeing a speech and lactation consultant 3 weeks before to do all the oral exercises. I know that sounds so silly. Exercises, you think about working out, but your tongue is a muscle. It's actually a huge muscle. We use it all the time, and so we need to be stretching it out and reteaching it how the baby to use it. So we want to do it 3 weeks before so they are used to us getting in their mouth, because nothing's worse than just having a release and the baby won't let you in their mouth. Why? Because their tongue hurts, right? And if we are not stretching it, it's going to close back together and we're back at square one. And so your breastfeeding journey isn't better. You say, I don't know why I did this. This was a waste of time. So let's make sure you are ready for the release to go smoothly. Then you're going to get the release done. You should go nurse your baby right away. Hopefully a lactation consultant is in the practice that you get to see right away, because dentists aren't really trained in lactation unless they've taken extra courses like myself. And then 1 week later, you should go back in and see the pediatric dentist to make sure everything is healing correctly. You want to make sure there's a diamond shaped. It looks like a white diamond underneath their tongue when you're stretching it. And so they want to make sure, get in and do the stretches themselves, make sure everything looks okay, make sure it's healing. That is one thing that has disappointed me the most, is that my pediatric dentist never had us come in again. No one ever saw me again or called me to say, hey, how's your kid doing? How's your breastfeeding journey going? Not once. So that's super disappointing. I hope they've now taken more education courses moving forward. But then after that release, you should continue to do stretches. I say for about 4 weeks, 3 to 4 weeks. 4 weeks would be optimal, right? Stretching them 6 times a day. I know that seems like a lot, mama, but 6 times a day, because we don't want it to close back together. Okay. One thing I say when you're looking for and doing the stretches, when it is closing, you think about a window. You never want your window to close. Okay. We want the curtains to shut. So let's say that again. So if you're thinking about this triangle, you don't want the triangle to close in on itself. Think about a window. You're shutting it straight down. You want the curtains to close and make a nice line. Okay, so that would be optimal. So mamas, I know, especially if we're getting this done in the first few months of life, we are tired, we are sleep deprived, especially if your baby has a tongue tie, especially. So I'm trying to help you out. And I created a tracker to track all the exercises. It's just a checkbox, right? But you can put in whatever day of the week you got released on. So let's say it's Monday. So you write in Monday through Sunday, and then you can cross off. I would keep it on the fridge, maybe in the baby's room, whatever's easiest for you, and cross it off, because I know more than once I'm like, how many times have I done this today? I have no idea. Right. And so I was told, just do it during diaper changes, just rub your finger across their lips, like under his lip 10 times, then run it under their tongue 10 times. You're fine. Don't be touching the wound, right? We need to go next to the wound. So anyways, it's a freebie you can download off my website at breastfeedingreliefwithbethany.com. Just download the freebie so you're tracking to make sure you're doing enough of the stretching to make sure it does not heal back together. It's been lovely talking with you, mamas, today. Please make sure you go and download that freebie. I also have a freebie of all the signs and symptoms of you think your baby might have a tongue tie. Those are wonderful to download as well. Please come and connect with me on Instagram at Breastfeeding Relief, or you can also connect with me on TikTok at Breastfeeding Relief as well. I would love to say hello. Please drop into my DMs. I would love to chat with you about your baby and how everything's going, and we'll talk soon. Thank you so much for listening in. If you loved this episode, it would mean so much if you would share it with another mama or post on social media and tag me. I want to personally thank you for wanting to help other mamas. You got this. I'm rooting for your breastfeeding journey.